Hi, welcome. We're here with Allie, who went to the Chile Public Health program. Welcome, Allie.
Hi.
So tell us about your experience with SIT.
So I just got back from the Chile Public Health program, and I had a great time. I loved Chile. It's a really fantastic country with just very diverse people, and with SIT we had the chance to really explore the country and go around to different parts, and then also explore the field of public health more, since our program was focused on public health. So we were able to visit clinics and do community outreach activities and take coursework in public health. So overall, it's a really great way to both explore the field of public health more and then also explore Chile and the Chilean culture and learn more about Latin America during the experience.
Great. And tell us about your feeling about the language study.
In terms of the language, I think I came in maybe as an intermediate Spanish student, and I felt like SIT prepared you really well. It is true that all of our courses and coursework were conducted in Spanish, and there were times when we didn't understand what was happening or didn't understand some of the lectures, but just being exposed to it with all the classes and also taking the Spanish classes at the same time to get some of the basics down. Just being exposed to it constantly as the semester went on, we all found that we were starting to absorb more and more information, and we were still able to get kind of 75% of the gist of the language, which is really all you can expect when you're going in as an intermediate basis. So it's a really good way to be exposed to a lot of the language and have a lot of opportunities to both speak and write in Spanish. So.
Great. And tell us about the classes. What did you think of the classes?
I really liked the classes. One nice thing about SIT is that in our program, they really tried to include a lot of local professors and teachers into the course load. So for our public health program course, our course was actually taught entirely just by guest speakers. So it was people from private clinics or from the environmental health department or from various indigenous tribes to speak about traditional medicine. So that was really cool. It kept lectures a lot more interesting because we had different speakers each time speaking about different topics, and they all had very different perspectives. So that was really, really interesting. And then we also had a methods course, which was nice because that prepared us for the ISP project, and it was taught mostly right in that last month right before the ISP project, so we were able to start developing our project while we were learning the methodology to make it happen. So.
And what did you study for your independent project?
For my project, I studied contraceptive access among adolescents in Santiago. So it was really cool because SIT Public Health program is based in Arica, Chile in the north, and it's kind of a small metropolitan town. So it was nice to go to Santiago, which is one of the biggest cities in Latin America, to be exposed to kind of the very different culture, different vibe, different customs of Santiago while also studying my project there. So that was really neat to have that opportunity to travel there and study independently, and then also really get involved with the people while I was there, because I was working with a clinic that does, they're trying to expand contraceptive access through mobile clinics in schools. So I got to interact with a lot of school children and then also people from the organization. So it's nice way to go to Santiago, to explore Santiago a bit, but also to interact with a lot of local people there as well.
And what did your day-to-day look like during your independent study?
For my independent study, usually I would go, my clinic operated 3 times a week after school, and they also operated in schools. They traveled around to different schools. So usually about 3 times a week I would go to the school for the entire day, and then I would go to all of their 3 times a week after school programs. And then the other days the rest of the days I would be usually researching background information and setting up interviews and emailing people back and forth. And I also spent some time on the weekends exploring Santiago with some of my other SIT friends who were there. So it was a good combination of being able to plan my own schedule, but also continue my research and just let everything build upon itself as it went on.
What do you feel like you learned overall from the program?
I would say I definitely became a lot more independent and learned how to organize things myself and plan things myself, because the independent project, they really focus on having the students really do the entire project and from start to finish on their own. So it's not that SIT selects a program and places you in that organization. It's up to you to contact the organizations and to find your way in there and to find your to direct yourself to that place and to find your contacts within that organization to set up how you're going to structure your project. So the ISP was huge in helping me gain independence and learn a lot more about organizing my own research and developing my research throughout the time. And I would say I also learned a lot more about being sensitive to other cultures, mainly through the homestay experiences. I actually had 2 homestay experiences because I stayed in Santiago with a homestay and I had my regular Arica homestay. So it was really, so I learned a lot about kind of settling into a different culture and learning that just because the family doesn't operate the way your own family does, doesn't mean that they don't love you or accept you in the same way. It's just they have different ways of going about things. So kind of learning different family routines and adapting to that and learning that every culture has their own way of being a family was also really interesting for me.
Great. And is there anything else you'd like to tell people that are thinking about this program?
I would say that SIT is really unique in that it's a field style program, and that was a huge part of my experience. That pretty much every week we would have field trips or clinic visits or community outreach opportunities, and that's something that you really can't get in many other programs because there's not programs that will actually let you take tours of clinics and interact with patients and hand out pamphlets to people and do community health outreach. And so that was a really nice part of SIT that I found that I couldn't really get in other programs. And I also think that SIT facilitates really close relationships between students, since my group was 24 students. So it was really nice to be able to make friends in that small environment. And we do most of the activities, most of the field trips and coursework and travel excursions all together. So it was really nice to be able to be with the same group over the semester and develop really strong relationships with pretty much everyone on the program. So that's another really key component of SIT that really made my semester all that much more enriching and great. So
great, thank you so much. That was excellent.
Yeah, of course.